Did you know that a single misplaced minute, just 60 seconds, can change everything? For many older adults, that tiny slice of time determines whether they will walk unaided again, speak clearly, or even survive a stroke. It's a sobering truth most people don't learn until it's thrust upon them. Every year across the United States, countless seniors feel the first subtle nudges of a stroke while doing the most ordinary things, sitting at the kitchen table, watching the morning news, or reaching for a cup of coffee. A hand suddenly feels strange. Words come out tangled. The world shifts for a second. Because these signs can seem mild or vanish quickly, many shrug them off, hoping they'll pass. But those early moments are not random. They are urgent signals from the brain, clear, pleading, and time-sensitive. What you do in the minutes before help arrives can protect brain tissue and preserve the life you know. You don't need medical training or equipment to make a difference. You need awareness, composure, and the right sequence of actions. This guide will walk you through 7 essential steps every senior should know to take in the first 3 minutes of a suspected stroke. Actions proven to save function and preserve independence. Stay with me. The knowledge you gain now could be the wisdom that keeps someone walking, speaking, and living fully. Before we begin, a small request. If you find this information helpful, please subscribe and enable notifications so you won't miss future practical health tips for older adults. If this video helps you, type 1 in the comments. If it didn't, type 0 and tell me how to improve. Step 1. Sit down immediately. When the first odd sensation arrives, a sudden wobble in your legs, unexpected heaviness in one arm, or a dizzy tilt that makes the world feel off-kilter, the instinct for many is to press on. Years of habit teach us to push through discomfort. But during the earliest minutes of a stroke, that instinct can be dangerous. The safest, simplest response is to sit down right away. Sitting isn't surrender, it's protection. For older adults, a fall during a stroke often causes more harm than the stroke itself. A sudden loss of balance can send someone to the floor and lead to head injuries, hip fractures, or spinal damage, complications that turn a medical emergency into a long recovery and can permanently reduce independence. Many seniors never return to their previous mobility after a fall-related injury. Sitting reduces the chance of falling, lowers strain on the heart and muscles, and gives your brain a moment to stabilize when blood flow to parts of the brain is interrupted. Coordination and judgment may falter, and vision can blur. Trying to walk or reach during that fragile window increases the chance of collapse. Sitting removes gravity's worst effects and makes it safer to call for help or access a phone, even if symptoms appear mild or fleeting. Don't ignore them. Transient weakness, a brief spell of dizziness, or momentary trouble finding words are often the earliest signs of a stroke. Sitting buys you safety while you decide the next steps. Step 2. Lie flat on your back when appropriate. Once seated and safe from immediate danger, consider lying flat on your back. This may feel dramatic, but it can help. With age, arteries stiffen, and circulation can be less resilient. When a stroke begins, parts of the brain are starved of blood and oxygen. Staying upright lets gravity pull blood away from the head, potentially worsening the deficiency. Lying flat creates a straighter path for blood to reach the brain with less resistance. That simple position can preserve more brain tissue while waiting for emergency care. Clinicians who care for older patients know that even small improvements in cerebral blood flow can influence outcomes. Lying flat is a low-tech, effective way to support that flow. Some may resist, feeling vulnerable or reluctant to act sick. Think of lying flat as a strategic choice. It helps the heart pump more effectively to the head, keeps the airway neutral, and may ease breathing. Reports from emergency settings often note that positions that favor circulation can help maintain neurological function in the short term. Step 3. Elevate your legs about a foot. While you're lying flat, raise your legs slightly, roughly 12 inches, about the height of 2 pillows. This isn't an old wives' tale. It is a practical step to encourage blood to flow back toward the heart and then upward to the brain. In older adults, circulation can pool in the lower limbs. During a stroke, every milliliter of oxygen-rich blood counts. Raising the legs increases venous return, the flow of blood back to the heart, supporting cardiac output and the amount the heart can send to the head. For seniors with peripheral artery disease, chronic venous insufficiency, or general circulatory sluggishness, this small adjustment can help. It also reduces the workload on the heart at a critical moment. There's a comforting psychological effect too. Elevating the legs often produces a subtle sense of relief, a feeling of being physically supported. In the panic of a suspected stroke, that tiny physical comfort can steady breathing, calm the mind, and improve clarity, making it easier to call 911 or to tell someone what's happening. Step 4. Breathe slowly and deliberately. Your breath is a tool. Panic triggers fast, shallow breathing that can narrow blood vessels in the brain and reduce the oxygen getting to vulnerable tissue, especially concerning in older adults whose cerebral vasculature may already be narrowed. Adopt a simple, memorable breathing pattern. Inhale gently through your nose for 4 seconds. Hold for 2 seconds. Then exhale slowly for 6 seconds. The 4 to 6 rhythm is easy to recall and helps rebalance your nervous system. A long, slow exhale signals the body to calm, which relaxes blood vessels and promotes steadier blood flow to the brain. Purposeful breathing also steadies emotions. When the body feels unfamiliar and frightening, slow breaths ground you. That emotional steadiness preserves mental clarity, helping you call for help, state the time symptoms began, and respond to questions from emergency personnel. In short, breathing with intention helps both body and mind. Step 5. Note the exact time symptoms began. This detail is one of the most important things you can tell medical staff. Stroke treatment is time-sensitive. Some therapies, like clot-dissolving medications or certain procedures, are most effective within strict windows. If clinicians don't know when symptoms started, they may not be able to safely give these treatments. Look at a clock or your phone and say the time out loud. It started at 3:12, saying it helps lock it into memory. If someone else is present, ask them to write it down. If you're alone, whisper the time to yourself and repeat it. Paramedics and emergency teams rely on that timestamp to determine the best care. Older brains are less forgiving of delays. Neurons that control speech, movement, and memory can be damaged rapidly when deprived of oxygen. Recording the start time preserves your chances for interventions that can prevent lasting deficits. Step 6. Remain still. Avoid unnecessary movement. After you note the time, resist the urge to stand, walk, or test yourself. Movement raises the body's oxygen demand and forces the heart to work harder, possibly diverting precious blood away from the brain when it's needed most. For seniors, moving during a stroke increases the risk of falls and secondary injuries like broken hips or head trauma, outcomes that can worsen recovery significantly. Stillness is a proactive measure. Staying put minimizes additional stress on your heart and blood vessels, keeps your airways safe, and conserves whatever stability your brain retains. Paramedics are trained to move and assess patients safely. You don't need to risk an attempt on your own. If someone arrives, let them support you rather than trying to get up. Step 7. Call emergency services immediately. This is the decisive step. Once you are in a safe position, breathing steadily, and have noted the time, make the call to emergency services without delay. If speech is impaired, use any sounds, partial words, or gestures you can. Dispatchers and paramedics are trained to interpret slurred speech and incomplete responses. Many older adults hesitate to call, concerned about embarrassment or expense, but waiting can close windows for treatment and reduce the chance of regaining lost abilities. Paramedics can assess vitals, begin life-saving measures, and alert the hospital ahead of arrival so the stroke team is prepared. Early notification can shave precious minutes off the diagnostic and treatment timeline. If a neighbor or family member is nearby, ask them to call now. If you have a medical alert device, press it. Use voice-activated calling features if needed. Prioritize help over pride. How the steps work together. These 7 actions: sit, lie flat as needed, elevate the legs, breathe intentionally, note the start time, remain still, and call for help are simple individually, but powerful combined. Sitting prevents falls, lying flat, and elevating the legs improves cerebral perfusion. Controlled breathing stabilizes blood pressure and oxygenation. Noting the time guides clinical decisions. Stillness prevents further injury. Calling emergency services triggers specialized care. In that first 3-minute window, your actions can significantly reduce the amount of brain damaged and increase the odds of meaningful recovery. Why this is especially important for seniors. Aging brings changes in vessels, heart function, and brain resilience. Conditions like hypertension, atrial fibrillation, diabetes, and atherosclerosis increase stroke risk and complicate recovery. When a stroke happens later in life, its consequences can be more severe, but that makes preparedness more valuable. Knowing what to do can reduce the chance a brief episode becomes a life-altering event. Acting quickly preserves dignity, independence, and quality of life. A short scenario. How the steps play out. Imagine Mrs. Alvarez, 78. She's making tea when her right hand suddenly feels heavy. She smiles at a neighbor, but her words come out slurred. Recognizing the signs, she sits down immediately, then carefully lies back on the sitting room couch with a pillow under her knees. She places the folded blankets under her calves to raise her legs. Breathes in the 4-2, -6 rhythm to steady herself, and glances at her phone to note the time the symptoms began. Because the neighbor is watching, they call 911 and relay her medical history and the start time. Paramedics arrive, quickly assess her, and call the hospital because she acted early. The stroke team can evaluate options that might not have been possible otherwise. Mrs. Alvarez's quick thinking kept her safe and preserved her chance for the best possible outcome. What dispatchers need to know. A simple script. If you call 911 during a suspected stroke, these short phrases help responders act fast. My name is your name. I'm age. I think I'm having a stroke. Symptoms began at exact time. I have brief list of major conditions, e.g., hypertension, atrial fibrillation, diabetes. I take name of blood thinner if any. I am currently sitting, lying with legs elevated. I can repeat a sample phrase, if possible. Stay on the line and answer questions as best you can, if speaking is hard. Type or have someone present relay the information. If you're alone, practical options. Many seniors live alone and worry about being alone during an emergency. These steps can reduce isolation risk. Wear a medical alert pendant or watch that connects to emergency services with one press. Use voice-activated assistance to call a trusted contact or emergency services. Keep a phone near where you sit and sleep. Enroll in a daily check-in program with family or community volunteers. Consider smart home systems that detect long periods of inactivity and send alerts. Medications and blood thinners. Key points: if you take anticoagulants, blood thinners, for conditions like atrial fibrillation, tell dispatchers and paramedics immediately. Blood thinners affect treatment decisions and may rule out specific clot-busting medications. Conversely, missing doses of needed medication can increase stroke risk. Keep an up-to-date medication list in a visible place and with you whenever possible. Transient ischemic attacks TIAs. Don't ignore them. A TIA, or mini-stroke, causes brief stroke-like symptoms that resolve quickly, even if symptoms fade. A TIA is a major warning sign and should be treated seriously. Call for medical evaluation. Early examination after a TIA often identifies treatable causes and reduces the chance of a full stroke. How families and caregivers can prepare. If you care for an older adult, help create a simple stroke action plan and practice it. Post a concise checklist of the 7 steps on the refrigerator. Keep a laminated medication list and medical history in a wallet and on the fridge. Prepare a go bag with records, medication lists, emergency numbers, and insurance information. Agree on a code word for call for help now in case speech is difficult. Learn safe ways to help someone lie down and elevate legs without causing injury. Call for help rather than lifting heavy loads alone. Common myths debunked. Myth: if symptoms stop, I can wait. False: temporary symptoms can precede a major stroke. Treat them urgently. Myth: I shouldn't bother 911 for fear of a false alarm. False: emergency teams would rather evaluate and find nothing than arrive too late. Myth: only very old people have strokes. False: strokes can happen at any adult age, though risk increases with age. Myth: I can drive myself to the hospital. False: driving during a stroke is risky for you and others. Wait for EMS. Lifestyle choices that reduce stroke risk. Preventing stroke is an ongoing effort. Practical steps include: control blood pressure, aim for targets set by your doctor. Manage diabetes with proper monitoring and treatment. Treat atrial fibrillation appropriately to reduce clot risk. Stop smoking and limit alcohol. Eat a balanced diet rich in vegetables, fruits, whole grains, lean proteins, and healthy fats. Stay active within your ability. Even regular walking helps. Follow medical advice on cholesterol management and medications when indicated. Rehabilitation and recovery. If a stroke occurs, recovery commonly involves a team: neurologists, physical therapists, occupational therapists, and speech therapists. Early rehabilitation often leads to better outcomes. Physical therapy improves mobility, strength, balance, and fall prevention. Occupational therapy teaches strategies for daily tasks like dressing and bathing. Speech therapy addresses speaking, swallowing, and cognitive communication. Social workers and case managers connect you with resources, home modifications, and community programs. Preparing emotionally. Strokes affect feelings, identity, and routines. Preparing emotionally can ease transitions, discuss wishes, and document directives. Like power of attorney and advanced care planning. Keep comforting, meaningful items accessible, photos, music, familiar objects. Join support groups to share experiences and reduce fear. Practice calming techniques, breathing, gentle stretching. Guided imagery you can use if symptoms begin. Questions you'll likely hear at the hospital. 2. Speed care. Clinicians will ask focused questions. Exactly when did the symptoms start? What did you notice first? Do you take any blood thinners? Have you had strokes or TIAs before? Do you have atrial fibrillation, hypertension, or diabetes? Brief. Clear answers help the team move quickly. A printable checklist to keep handy. Phone within arm's reach, clock visible in main rooms to pillows. Blankets under the bed or couch for leg elevation, medical ID bracelet or card visible.